Good evening. I am Ruth Price Rollins, and I am the president of Delta Sigma Theta Sorority, the Greater Cleveland Alumni Chapter. It is my pleasure to welcome you to tonight's event and to thank you for attending tonight's community conversation. I am wonderfully excited that our physical and mental health committee is providing you with this information, and we hope that you will be provided with information to keep yourself and those that you love safe during this pandemic. I want to thank our Physical and Mental Health Committee for bringing this to you and to those that you love. And at this point, welcome. I will now turn it back over to our Physical and Mental Health Committee Chair, Kalia Fisher Grace, to introduce tonight's speakers. Thank you.
Okay. Thank you all for joining in. I have the pleasure of introducing our panelists tonight, starting with tonight's moderator, Dr. Pamela Jones. Dr. Pamela Jones received her bachelor's degree in psychology from Kent State University, where she was also initiated into the Epsilon Mu chapter of Delta Sigma Theta sorority. After graduation, Pamela obtained her doctorate of psychology from Wright State University's School of Professional Psychology. She has almost 10 years of clinical experience in the area of community mental health and college counseling, as well as more than 12 years of business consultation, change management, and strategic development experience. She currently serves as the operations director for several early learning centers, as well as provides business consultation and strategic executive management expertise to businesses in the greater Cleveland area. Dr. Shanina Knighton is faculty at Case Western Reserve University, where she works as a clinical nurse scientist, KL2 scholar, and part-time assistant professor in biomedical engineering. Her work focuses on infection prevention and control, including technology-based interventions to improve patient hand hygiene, identification of harmful bacteria and viruses on patients' hands, and strategies for implementing infection prevention guidelines in different settings, including the Cleveland VA and Metro Health System. Dr. Knighton spent over a decade at the Cleveland VA as a bedside nurse and also as a National VA Quality Scholar, where she obtained interprofessional quality improvement and clinical research training in infection prevention and trained medical and nurse practitioner residents. She received her Doctor of Philosophy from Case Western Reserve University School of Nursing. She has served various leadership roles, including the National Research Committee for the Association for Professionals in Infection Control and Epidemiology. To date, she has received multiple federal grants, fellowships, and awards for her contributions to science, including the National 40 Under 40 Minority Leader Health Award. Dr. Shanina Knighton was initiated into the Theta Eta chapter of Delta Sigma Theta on April 29, 2005. Today marks her 15-year anniversary of sorority membership. With that, Pam, please take it away.
Good evening, everyone. Thank you again for joining in tonight. We are so excited to be with you and to share with you just some hopefully that you find this information really helpful and useful during these uncertain times. So with that, I want to jump right in with Dr. Knighton, and we hear this wonderful bio of all the amazing things that you have been doing, but share a little bit more specifically about your area of expertise and what makes the information that you're going to share tonight specifically more valuable for us as we're moving forward with this COVID-19. Dr. Knighton, you got to take yourself off of mute.
Thank you for that.
No problem.
So thank you, Dr. Jones. It's interesting. So infection prevention and control does differ from epidemiology as well as, let's say, public health. And so it does include information from, let's say, epidemiology or public health, but it focuses on the science as well as control mechanisms for being able to stop and control infections. And so similar to Kalia's role, you know, we function in healthcare settings where these roles of infection preventionists are regarded by the Joint Commission as being mandatory. So there are so many infection preventionists that you would have to have in a particular facility. And so our role, let's say, as a nurse, because specifically, not to say all infection preventionists are nurses, but the majority of nurses would be an infection preventionist. And so you find that we focus on how can we make sure that while people are coming in to receive care, that they don't leave hospitals and other settings with other things, particularly infections.
That's great. So with that, let's jump right into you explaining to us exactly what is COVID-19.
Okay. So COVID-19, I think not necessarily because we haven't heard of it, but just even too, just really quick before we get into that, I think we also have to just kind of give a shout out to the great work that we are doing for physical and mental health. So I'm sorry, Dr. Jones. But for our viewers and watchers, you know, we are hosting a medical supply donation drive-through by allowing to help the university hospital's frontline staff by donating unused face shields, eye goggles, rubbing alcohol, hand sanitizer, Clorox wipes. And so these items, we're hoping that because you are seeing this webinar tonight, that you'll be able to drop those items off tomorrow on Thursday at our Delta Foundation Center. And so we will make another announcement just as a reminder, but if you are somewhere near the area or have these supplies, we have frontline staff that could very well appreciate you taking care of them as they continue to take care of our communities. And so, so now back to your question. So with COVID-19, so I first want to say that COVID-19, it is a respiratory infection that attacks the lungs. And so it ends up resulting in pneumonia symptoms and a pneumonia diagnosis through virus, not necessarily through bacteria. So pneumonia can be viral or it can be bacterial. What's interesting is coronavirus itself is not new. So we've had the severe acute respiratory virus. We've had the Middle Eastern respiratory virus. Both of those were different types of coronavirus. This particular strain is different and has exhibited different symptoms as well as it being highly transmittable. And so we know that fever, chills, we know that sore throat, difficulty breathing. I would say that the difficulty breathing is one of the cardinal signs that makes this different. Also, early signs of loss of smell and loss of taste has been reported. And even recently, as they're observing young people, as well as older people that are minorities, they're finding that clots are resulting in strokes, and this is leading to some of the deaths as well as some of the complications.
Thank you for all that information. And so it really speaks to then my next question of your thoughts as to why the number of COVID-19 cases are continuing to rise. I know especially in the last 24 hours, we've seen a lot in the news, even in the state of Ohio. So share a little bit your thoughts around why these cases continue to rise.
So we'll circle back around to this a couple of times just as a reoccurring theme, but I want to remind people that it's a moving target. So at this very second, we don't have a vaccine. We have limited testing. And because we have limited testing, the tests are not being administered quick enough for us to be able to catch it. So for example, let's say that we are in some sort of meeting, like let's say we're in sorority meeting, and our president says, hey, we're going to swab everyone that's coming into sorority meeting for a COVID test. Let's say this COVID test is a 24-hour test. So we leave, we go out, we're around our families, we interact, and then we come back, let's say 2 days later to read the results. While all of those results from the prior 2 days may be negative, it doesn't account for the interactions that we've held in between. And so while there is a high emphasis on tests, the problem is by the time we've all interacted in different environments and have done different things, then we're pretty much at a different level of risk because we are interacting with each other, but we don't know who each other interacted with.
That makes sense. And so with that, again, especially the interaction part of things, we've started to hear a whole lot about social distancing. It's been constantly stressed and re-stressed in terms of one of the major ways to maybe mitigate or buffer this disease. So share a little bit more about what role social distancing does play in managing COVID-19.
So the one thing to realize is that we may encounter someone that may have, let's say, incorrect hand hygiene practices. They may sneeze or cough without covering their nose. They may do things and they may very well be contaminated with COVID. There's a lot of factors that have to go into someone being able to stay preventative. So it's not just one action. It's almost like driving a car, how the car has to have gas. It has to have all of these different mechanisms in order for it to be able to work efficiently. This is the same situation. And so social distancing, by saying, oh, well, just stay away from each other. It's almost like two siblings arguing and you saying, you know what, just stay away from each other. It doesn't resolve the issue, but it at least stops the arguing, right? Mm-hmm. And so the thought process is with social distancing, if hand hygiene is done incorrectly, which we know that only 3 to 6% of Americans do correctly, then we know that all else, if that fails, then people will still be safe because they've kept distance away from each other. The other thing is personal protective equipment. And we'll also get into that a little bit later. But if you think about just social distancing and being out recently, how many times people still may violate that, or they think that, hey, social distancing may mean that I can be around my cousin, but I can't be around a stranger. So even the definition of it is used incorrectly. But it is necessary because we don't have a vaccine. The other piece of it is this: the long-term effects associated with COVID that are now starting to show. They're finding that people have long-term conditions such as liver failure, such as lung failure. So you're seeing a lot of infiltrates that are now on the lungs that have not disappeared from the first 3 to 4 months of people that had COVID. Brain conditions. There was a little girl that was in Michigan and her symptoms did not show up that looked like the traditional symptoms that have been reported. And so because we understand that, social distancing means that if you go in, so if you look at the upper right hand of the corner and there's that swab, right? So if someone does not swab deep enough into the cavity, that can come back as being a false test, but they very well may have COVID. There could be a situation of limited tests. So there's been situations where one family member was able to get tested, but the other ones were not able to get in quick enough. So social distancing is just the best way to make sure that you can eliminate putting yourself in that situation.
And that also makes sense in terms of our previous question about possibly why cases are still continuing to rise, like you're saying, with the testing and potentially people, again, not utilizing social distancing and correct hand washing at all makes sense in terms of how this disease is continuing to spread.
Exactly. And even too, really quick, Dr. Jones. So I actually showed this video previously, but I think it's worthwhile showing because sometimes people don't even think about the fact that we don't correctly clean our hands. And it's only about 45 seconds, but this is honestly, someone washes the front, they may wash in between, and they may wash the back. So they wash the back, but if you look at still all of the areas where the white is, those are areas that pretty much gets left unclean. And I know that honestly, there's not a lot of people that clean their hands like this. And if I am out in public, I'm conscious to clean my hands like this. But if we're at home and we know that it's our own germs, many people transfer that same behavior of not cleaning their hands correctly at home to cleaning their hands also too in public. And so it takes a faulty hand washing that could also too put you in a bad situation.
Absolutely. Absolutely. So as we think about, social distancing is one of the mechanisms to manage this disease. There's also been other recommendations in regards to face masks and other forms of covering to also, in personal protective equipment, to also manage COVID-19 and the spread of it. Share with me your thoughts around some of these other personal protective devices, masks, etc.
So everything has to go together, just as I mentioned with the analogy with the car. And so with a mask, how I mentioned social distancing and hand hygiene being the first line of defense, if someone does not clean their hands correctly before they apply the mask, they could be applying germs directly to their mask, therefore applying it to their face. Same thing with the gloves. And so you're actually trying to put your hands inside of some gloves in order to be able to keep yourself safe. But if you're putting your hands inside of some gloves and they're not clean, you're pretty much keeping the dirt right next to your skin. And then when you take them off and you just assume that your hands are clean, you forget that the gloves are porous. And so germs can seep through from the gloves onto your hands. And unfortunately, that's something that people forget. And so you are adding mechanisms, or I would say items, to people. It's just like a woman, how we move our hair out of our face, or, you know, if we get our hair braided and you're constantly moving that braid. We're talking about something that is not a normal part of our face that we have to consciously manage, with us still answering cell phones, with us still managing glasses. So some of us are still managing eyewear. There are a lot of other things that go on. Some people even have assistive devices. So what happens for the person that has to wear oxygen and they have like the nasal cannula, which has to go in their nose? And so we're talking about some mechanisms of personal protective equipment that is different. Now, personal protective equipment for the public is different from healthcare workers. So when we're talking about healthcare workers, and let's say they're talking about the emphasis of an N95 mask or a KN95 mask or a surgical mask, these masks are one-time use masks. They've never been made for us to use more than once. So the emphasis about a company coming in and cleaning them is very important, because what that does is that ensures that if they go from person A to person B to person C, that they're not taking those same contaminants in between, and that they're not potentially cross-contaminating to themselves. And so I also emphasize to the public that when we're talking about an N95, we have to go in and receive an annual test. And that annual test requires them to spray a mist into the air, and it tastes disgusting. But if I can taste that mist, then that means that I am not safe with that mask on. And this is a occupational safety hazard requirement that we have to do this. It's done annually, because if someone gains or loses weight, then they have to get a different mask fitting. And just because, let's say, you may be a heavier person or a smaller person, it does not necessarily mean that your face may fit a small, medium, or large. So it is something that's necessary. So a lot of people that are walking around with N95s, they may or may not be protected right now.
Thank you for that. And can you go back a little bit to the gloves too? You know, I think that that's an important part of the protective equipment as well. Like you were saying, I see a lot of people in stores, a lot of people out and about, and they're wearing gloves, but then they go into their personal area, whether it's their car, and then they're not doing kind of the right things to make sure that they're not cross-contaminating. Share a little bit more about that if you could.
So it's interesting, because thinking about the process of even putting the gloves on, and so no hand hygiene occurs. So they come in, let's say they put the gloves on, they now are pushing a cart. So they're now taking their hands, which they assume these gloves are clean, and let's say they wipe down the cart. And now they're grabbing all of these things from off the shelves and they're putting them inside of their cart. Let's say cell phone rings or it doesn't ring. You're reaching in your pocket. COVID loves plastic, by the way. COVID loves plastic, metal, it loves cardboard, and it can live on these items for up to 3 days. And so you have these gloves on. So at what point do you take these gloves off to grab your debit card? At what point do you interact or not interact with the touch screens or with the cashiers, and you still have these same gloves on? And so now people will take these gloves and then they'll go to their car. So let's say you have an automatic trunk, so you don't have to touch any buttons, but now you have to put your groceries in there. So you're now having to touch the bags with the same gloves on, and then you go home. So you've already touched your items and contaminated them at the store. just by touching them with the gloves, and now you're taking them home with the contaminated gloves instead of just practicing hand hygiene in between and disinfecting them once they make it home.
Makes sense. Completely makes sense. Thank you for that.
You're welcome. So I actually have a question for you. Considering social distancing and understanding, Dr. Jones, that this is your background, what recommendations do you have for people in terms of keeping in contact with their loved ones, maintaining some sort of social life, managing their mental health during this time, and even being able to practice self-care from the personal aspect? Like, what are your recommendations pertaining to that?
Mm-hmm. And we, as you were saying, we know that social distancing is an important mechanism to manage this COVID-19 virus. But we also have to remember that social distancing doesn't mean social isolation or social detachment. And so it's important that we still remember mechanisms to continue to use to keep ourselves engaged with our family, our friends, to keep ourselves engaged in activities that bring us energy and bring us joy. Because the reality is that with us being more confined to our homes, it can bring up feelings of isolation. It can bring up feelings of anxiety. It can bring up feelings of depression. It's okay to name those things if that's how you're feeling. But again, remembering ways to continue to stay connected to people in these times, it's finding creative ways. Again, maybe using video platforms, maybe you're using social media platforms, you're doing creative things, like, again, going for a walk, but maintaining that social distancing. You are, again, doing different types of video chatting and things like that to stay connected to your family, friends, your sorors. So it's really important to ensure that you are continuing that social connectivity. It's also, again, important, as you were talking about with self-care, to make sure that you're bringing in activities still that bring you joy, bring you energy. It's a great time to throw on a video and maybe do a mindfulness activity or to do some exercising. Again, you can get out the house and you can still go for those walks. You can still take a nature walk or just go outside and get some fresh air. And so make sure that you're doing some of those things that, again, bring you energy, bring you joy. And it's also important to make sure that you're still doing those personal check-ins, and that if you are noticing things that are different, if you're noticing that you are feeling a little bit more down, more so than you usually have been of late, especially if it's lasting for a few weeks and you can't kind of pull yourself out of it, taking note of those things. If you're feeling like you can't sleep, if you are feeling anxious, if you're feeling, again, just kind of sad and down and you just can't shake it, it's okay, again, to name those things and then to reach out and get help. There are still a lot of practitioners that are doing teletherapy. So you could do a video session, you can do a phone session. There are still hotlines and things like that to reach out to, again, if you feel like you do need some additional support. And that's okay. Again, we're in times right now where things are very uncertain and we are not used to, again, figuring out different ways to engage and to connect to people. And so as we kind of go through these different motions, it's really important to get additional support if you feel like you need it.
Awesome. Thank you so much.
Absolutely. So, again, as we are kind of just going through this process and we have been in this stay-at-home phase for a while now, I think we're going on 6 or 7 weeks. We definitely are, we see that some of these states, and we've heard from our own governor about how things are going to start to open up. And some of these orders are going to be lifted a little bit and kind of relaxed. And so it begs the question of what is going to be our new normal? What is this new normal going to look like as we move forward? And some of us still don't feel comfortable. Some of us are still very much concerned and anxious, as we should be, because things are going to look different. So, Dr. Knighton, I'm curious in terms of your opinion on what do you believe this new normal is going to look like, and what precautions do we need to take as we move forward, especially as we're moving into summer months, and we know we have barbecues and reunions and things like that. We want to get out, or enjoy the weather and fellowship again. But what should we be doing, and what does this new normal look like as we move forward?
Gotcha. So it's interesting. So I have two things that I want to say pertaining to that. So it's a good thing and it's a bad thing. So one being that for healthcare workers, we have to realize that in so many words, we made them the military inside of the United States without going to boot camp. We've made America or Americans, and I'm just saying America in general, we've given them a crash course in infection prevention. And the only thing that I can recommend, whether we have to go out, stay in, is to be kind and understand that a lot of our counterparts or a lot of the people that we interact with are not trying to do us harm, but to understand that unfortunately, there are things that we will do that we will not do perfect. So there's going to be someone that's going to be out that have great intentions but may make bad mistakes pertaining to the current climate. And these are things that maybe they just don't know. And so I always just emphasize be kind, and it's okay to kind of redirect someone or just kind of let them know that maybe you should do something different. I have this video and I actually put it together. It's no longer than a minute, but I just really would like people to pay attention to what's happening with items. And I want you to put yourself in the context of being at work, being at a sorority meeting, being at a conference, and thinking to yourself, what could have been done different? And I'll talk about that afterwards. But I even gave you little clues to pay attention to. So this is Nancy Pelosi, and this actually happened late last week. Oh, let me go back. Give me 1 second. There we go. So this happened late last week. So as you can see, the mask is supposed to catch the droplets, but look at her wipe her nose. So she touches the lectern, as you see, and then she wipes her nose again. The mask is meant to cover it up so that way you don't do that. So she does that, and then it transitions into the next person who walks up to this podium. Give me 1 second here. It's creeping slowly. She's really creeping slowly. 1 second. So then shortly after she comes up, so then Auntie Maxine comes up. So Auntie Maxine comes up to the podium. You see she has her gloves on and she touches her chest. So this is the same lectern that they're coming in contact with. The other thing that's not talked about is, her mask still up under her chin. He kept his mask on, but what about the mic? So the mic was adjusted multiple times with these individuals' hands. They're still touching the lectern. They're still touching the mic. And then she decides, I'm going to take my mask off and I'm going to hold it in my hands. And not even thinking about the contaminants that may be on the outside of the mask. COVID is transferred through the mouth, through the nose, and through the eyes. So potentially, is it her glasses that's going to contaminate her? Is it going to be her hands that's going to contaminate her because she puts her hands in her face by having to put the mask back on? The reason that I am showing this particular video is because, again, I don't think that any of these leaders are intending to do anything wrong. It is just understanding that the habits that we have around personal protective equipment can be more dangerous. I too included a link here from the CDC site that I just want to go to briefly. I'm summarizing this because the reason that we have individuals that are confused, you will go out and you will see people that are going to be doing one thing, which is having on masks, and you'll see others that don't. But when you have certain areas of CDC site that says PPE is less effective control because it involves a high level of worker involvement and is highly dependent on proper fit and correct use and consistent use, it gives some people the notion that if they can go to one area of the CDC site and find that it works and another part that it doesn't, what do I believe? So then you go down in the same area and they say that these cloth face coverings are intended to keep the person wearing them from spreading respiratory secretions. They are not PPE, and it is uncertain whether cloth face coverings protect the wearer. and it actually gives you guidance that is available. My rationale in showing this information is just to understand that there is some people that believe that masks work, some that don't. There are risks either way that is associated with it. It does stop some of the secretions from traveling through, but just as it was mentioned above, if someone does not wear it correctly, it puts someone at risk. And let me get back. And so to add on to your question in terms of, well, what does life look like in terms of managing our new normal? So family interactions, they do look, businesses reopening do look different. Restaurant outings look different. We're also forgetting that we're embarking upon allergy season. Some people are naturally going to sneeze. Some people are naturally going to have itchy throats. And unfortunately, they're inundated with thinking that everything is COVID. So that's also one problem. People even look at you funny now if you're out and you sneeze, and it's just a sneeze. So when we're looking at what does it look like right now in May, as we know, going into the summer and possibly into the fall, we don't have a vaccine. Not having a vaccine means that there's people at risk for getting COVID. Getting COVID means that you are at risk for getting some sort of long-term consequence, such as some sort of lung failure, such as some sort of heart failure, some sort of neurological disorder. These are findings right now. And I follow Black Enterprise News, and yesterday they reported that Scarface, which is a rapper, is on dialysis right now. So he's fully recovered from COVID, but the consequence from COVID is that he's on dialysis. He's not the only person with this story. And so while I see summer camp, meetings, conference events, everyone wanting to return to what I would say a normal within the next few months, going into the winter, I say that I want to see people not just 12 months or 18 months from now, but I want to see them 5 to 10 years from now, not suffering from chronic conditions. These conditions are already plaguing the Black community. And so they're being complicated and they're being prolonged, and the numbers are being added to because it's complicated by COVID, which then gives us a double whammy of things that we already may be susceptible to. When going to restaurants right now, so the one thing that is talked about in the media but is not talked about is science. It is very important that if you are looking at, let's say, articles, what are they saying? So what are they saying in the actual articles? So if there is something on there that mentions to you, oh, COVID is airborne, be nosy. Ask questions. What does it mean airborne? Were they outside in a public setting at a park? Or were they testing it under the conditions in ICUs? So now people think that COVID lives in the air, meaning that I'm just walking outside and COVID is just floating around in the air, because that is the perception that has been given. The airborne study that was done was in a closed unit of an ICU. Reversely, as I mentioned with the restaurants, there was actually a case that came out last week where 9 people inside of a restaurant all tested positive for COVID. And it was because of the heating, air conditioning, and ventilation systems. So HVAC systems do have a capability, if they are not done correctly, of transporting COVID. When we think about schools and our kids going back, what safety measures will they put in place in order for them to safely go back? Because there is asymptomatic and symptomatic, making sure that you're not putting yourself in a predicament of where you are asymptomatic but potentially could be building clots. So when I look at these next couple of months for me personally, and it's not just being in this lens, I'm still thinking that an ounce of prevention is worth a pound of cure. I'm thinking that it's best to say, hey, while I want to do these activities, and this is what we traditionally do, let's do this now and prevent it now, so that way later on we can socialize and we can have a good time and we can return to what will be the new normal. But understanding that if that does not occur, then we are putting others at risk and may have a different narrative to tell by just rushing.
Thank you for that. So you speak to, again, kind of being wise as we are moving forward, and again, thinking about what are things going to look like summer, fall, moving into winter. Again, hopefully people who have contracted this virus, not having long-term chronic illnesses from this. So again, in terms of predictions, 8, 12, 18 months from now, what are your thoughts? If there is a vaccine that I know, they're working on, if there's a vaccine that becomes available, what are the considerations that specifically our community should be aware of and consider?
I would say look at our track record, or the track record that has occurred so far. So whether it's minorities, and I'm specifically speaking of people with language barriers, that we're 2 months out, and last week they were just given information in 12 other different languages. So the fact that that wasn't considered ahead of time. When we're looking at ourselves right now, we're talking about Black communities that cannot get testing right now. So we have to make the same assumption that just because we can't get testing right now, what means that when that vaccine becomes available, that we'll be first priority to it as well. And so when I mention prevention, whether it's now, whether it's 18 months from now, these practices that I'm speaking of just keeping safe, it could be a COVID-19, it could be a COVID-20. We can be talking about multi-drug resistant organisms. These are safety mechanisms that 12 to 18 months from now, we should be thinking about and putting in place. When someone, down the line is practicing self-care, as you mentioned, which is most important. Some women enjoy going to get their nails done. So is there going to be some sort of practices instituted to where people have to scrub their hands, monitor to make sure that they're clean? Because many, just as I alluded to, COVID loves plastic. So can you imagine someone that may have just wiped their nose, positive for COVID, and now their nails are being fouled, and that ingestion of those dust particles going into the air? This is a reality. When people get their hair washed, our eyes may run. Think about how it's dried. That very well may seem silly now, but it does matter. So microphones, just as we saw there, being at a microphone and thinking about talking and who's going to come up to that mic or make sure that it's sanitized properly, especially if it's one of those ones where we adjust because we're all not the same height. If we are talking about just passing materials or just fellowship, being able to do that in a manner of which we understand that we're not going to do unintentional harm. And so these are things that we will have to consider. And unfortunately, there are no guidelines in terms of how this looks, but this is why I'm doing my best to make sure that I'm getting information out, that we're getting information out, to the public, so that way they understand that these are things to consider, so they can try to figure out what that new normal looks like.
Sounds good. Thank you for all of this wealth of information. It's been so informative and helpful. I want to turn it over to the chat at this point to see if there are any questions from our participants that they would like to ask Dr. Knighton or myself. So with that, I will turn it over to Kalia.
Well, thank you, everybody. If you have questions, please feel free to put them in the chat. While we're waiting on people to put items in the chat, there are none right now, so we may just ask you to raise your hand. But while you're getting ready to ask your questions or think of questions to submit or raise your hand, I do want to go forward with the raffle or with the announcement of the 13th participant. Marche Thompson is the winner of the $25 Giant Eagle e-gift card. So you'll receive your gift card via email by tomorrow. So thank you for registering, being the 13th person to register. We'll send you your e-gift card. I will start with a question to Shanina. The first question is, why does it matter, or why is it important to preserve the workforce, the healthcare workforce? Why was that such a big deal or a big need, and largely driving the stay-at-home orders?
So prior to COVID-19, our hospital's capacity, and this is just across the board, would be at about 75% to 90%. These beds are filled with people with multiple chronic conditions that, and when I say multiple chronic conditions, I'm speaking of people with high blood pressure, people with diabetes, and maybe mismanaging their sugars. We're talking about still potential patients that have car accidents. We're talking about poison situations, children in poison control. Like, I can go on and on and on. Also, too, multi-drug resistant organism related, such as sepsis. I can mention a lot of situations that would cause the beds to be full. So when we mentioned the workforce, and in terms of just staying at home, these people are still patients. We're still patients. So we're all still patients. They have to go in and be able to provide care to people in general. And if they are not well and we have a strained workforce, then we have people that are not taking care of the emergencies that are happening. We have people that are not able to treat COVID-19 patients. And so who's there to take care of us? And so I know that seems like a simple answer, but if these people are strained, and I'm specifically talking about healthcare staff, I'm talking about the people that have to come in and clean, the people that handle waste management, the engineering behind the scenes, the administrators. If healthcare workers are sick, then who's going to take care of the population when they have conditions and, and need services? And so it was important for people to stay home, because how many times prior to them making people stay home, just within that course of a couple of days, was the surgical mask sold out, the gloves sold out. You couldn't find hand sanitizer anywhere. These items, had things been done maybe a little bit quicker or differently, could have lessened the strain on the healthcare system that didn't have the correct equipment that they need to take care of patients.
Kelly, I think you
Can,
need to take yourself off mute.
can we speak, or
Thank you.
can you hear me?
Yes.
Okay. Hey, Dr. Knighton. This is Caroline Brooks. My concern is about the vaccine that they're working on. You hear stories of them rushing the FDA and CDC trying to get the vaccine approved and that kind of thing, and saying that our population, the Black community, is so at risk and so vulnerable to um, uh, not only catching the COVID-19, but because of our comorbid conditions that we have, would make us more susceptible to catch it. This vaccine, I'm leery about it, and I'm thinking that, are they going to eventually end up and use our community as the guinea pig? I always say, are we going to be flying around here with wings in about 6 years? I don't know. But are there ways to avoid from getting the vaccine? I hear that there's some components in each vaccine that is like an infringement of rights. And just wondering what your thoughts about, getting these vaccines sometimes. I'm an advocate for the flu vaccine and things, but I don't know. This one just seems a bit different, and too many unknowns.
And that's understandable. And I thank you for bringing that up, because not only do you have that concern, but a lot of other people have that concern. I can tell you that I was working on the floor pregnant during the time of H1N1, and did not get the H1N1 vaccine because it did come out rapidly. And so even understanding right now, like they're saying that they're getting closer and closer to a COVID vaccine every day, right? What does that mean? And so the questions that I will ask and do want to ask is, when they're testing it on animals, are we talking about mice, and if we are talking about mice, am I talking about a melanated mouse, that would look like me and you, that's behind a trash can, or am I talking about one that's pink with blue eyes? Because
Right.
if it is one that's pink with blue eyes, then I would question, is that particular vaccine, is it tested on my kind of people or on a kind of animal that would be reflective of me? This is not something that, of course, people would know to ask. The vaccination trials, FDA makes this information available. Unfortunately, none of this information is digestible for the public to be able to understand. So it is more important that there are advocates that when this information does come up, they are putting that information out there. Two, I'm mentioning that there's a potential flu vaccine, right, that could be available as soon as this fall, or let's say like the winter. That doesn't necessarily mean that it will get into our communities as soon. And so with that being said, I think that there will be time, unfortunately, for us to be able to observe what's going into it prior to it being rolled out. So anytime that you see, oh, there's a vaccine and Johnson is behind it, they have to post that information, if it is human subjects related, on clinicaltrials.gov. We have to find a better way, and this is not just a now problem, this has always been a problem, that the information is not accessible for people to be able to read nor to be able to understand. And so people do have a concern about vaccines, and in particular, will this one cause me to actually have a stroke or have some sort of condition that puts me in a worse predicament than what possibly COVID-19 would have? And I'm expressing to you that your concerns are valid, and that the things that you should look for is what kind of animal was it tested on? Was the animal genetically modified? And when you started testing it on people, I don't want to know the composite information about what it did to the majority of people. I want to know what it did to the minority of people, because the minority of people could be the majority of us.
Right.
And so that's a very good question. And so when you ask, is there a way to get out of the vaccine? My concern at this very second is that COVID-19 is skeptical in terms of whether we build up antibodies against it. Similar to like chicken pox, how if you got the chicken pox and they would do a chicken pox party and everybody would get it. Right now they're showing that people are reinfected. And if they are reinfected, is that putting them more at risk for organ damage? And so unfortunately, that is the consequence that we're up against. It does suck, because it's like, geesh, do I choose to get the vaccine, or do I risk possibly getting it and then having this fallout? And I'm just saying, like, continue to look at the literature, look at what's out there to make sure that you are making the best informed decision for yourself, should you choose to take it or not.
Yeah. I know for one thing, Dr. Knighton, is that they say do not refuse the vaccine. You have to have an educated reason behind not getting the vaccine, because if you do refuse it, then you'll be considered belligerent and not a team player and that kind of thing. But I know that a lot of the vaccines have aborted fetal cells in them, and
Exactly. Yep.
that's an infringement of rights, and some other things, so I don't know, it's just sort of frightening.
It is, and I think that's more of a reason why I had these ongoing conversations.
Right.
And so I can anticipate that as the time get closer, unfortunately, everyone doesn't have, resources such as our sororities, such as our churches, in the area that's making sure they get this information out. But the goal is to make sure that we are staying as up to date as possible, making sure that our communities are being informed in order for us to be able to move forward as we continue to know more, as well as being able to filter out basically what's false and what's not, because there is mixed views, that are going on. There are mixed beliefs. But the thing is we have to make sure that everything that we're paying attention to is science-based. And so I do hear your concerns.
Thank you, Dr. Knighton. Thank you.
You're welcome.
So, Dr. Knighton, there's a lot of questions that have come in the chat, so we'll try to get to all of those next.
Okay.
The first I can answer, it's a question about volunteers for the supply drive tomorrow. At this point, we do have enough volunteers. We're being very cautious to make sure we're socially distancing. We're using social distancing, and so we do have the appropriate number of volunteers, so thank you for that question. This question is from Sora Lori Washington. Are there any special methods for sanitizing homemade cloth masks being distributed throughout our communities?
Thank you so much for asking that question, because that honestly was one of the biggest concerns that I had, was that the CDC information that they put out was very vague. And so I will make sure that I share a link. Actually, if you Google, I hate to kind of be informal, but if you Google Forbes and Knighton, which is my last name, which is Knighton, it will come up with an article, concerns that were not addressed by the CDC guidelines. And so, for example, when mentioning the laundering, it is very important that we understand that our face is more sensitive than our bodies. So just because we launder our bodies in Tide does not mean that we can put a mask in there and expect that it will not have those same contaminants on our skin. And we work too hard for the skin, okay? So the last thing that we want to happen is something to get on it and mess it up. And so I suggest that if you have some sort of facial soap, soap is soap. So if you have a facial soap that you will wash your face in, or let's say it doesn't work for your face, but it's, maybe lingering around, my suggestion right now, if we were to be doing this for our community, some of us have those facial soaps lying around that we will not use for our face because we found out it broke us out. We found out that it didn't work. Those things are just as effective for being able to clean masks. But the community has to clean those masks every single day. And the reason why it has to get cleaned every day is because if they go out, they touch the outside of the mask, if there is something that someone possibly sneezed in the area right before they got there and there's droplets on the outside, it has to be clean because it can be a vector for transmitting infections just as much as it can be for helping to prevent some of the transmission.
Perfect. Then there's a thread amongst 3 questions about the summer months and the fall months. So I'll try to read a little bit of Monique, Lori, and Fabian's question as it relates to the seasons.
Okay.
Will COVID completely go dormant over the summer months? Do you think the virus will return in the fall? And what type of preventative measures are in place for the second wave of COVID?
So one of the things, when it comes to the summer months, I think we're going to see different things in different states. We're going to see different things in different cities depending on the measures that they let up on. For example, going through TSA, right? So TSA currently, as we know it, and I haven't traveled, none of us have traveled, but we understand how many people come in contact with the kiosk screens. We know what we have to do with putting our items down, with being able to put our items traveling through. We may be traveling to, let's say, Florida that has like a least restrictive policy regarding infection prevention. And because they have those least restrictive, their numbers may be higher. We may potentially travel from there and bring them back here, and then it continues to spread and spread. So we're talking about, again, a moving target to where we are not sure about the numbers. We do know, though, that everything is opening back up for economic reasons. It's not opening back up because we have done enough testing. It is not opening back up because COVID-19 is this safe thing that we're finding is not going to kill people or harm people as bad. And so, as I mentioned, with going into the summer months, with things reopening slowly but surely, it does not mean that things are more safer. It is just trying to return to some level of normal in the amongst of a pandemic, long story short.
I have a question in regards to, so my concern is the statement that was made that this is hitting the Black community really hard. And I believe it's because of the way that people eat. We don't have real nutritional value in the food that we eat. And is there anything that can be pushed out to let people know that they need to build up their immune system. So that would be.
So you absolutely right. And
Shani,
that's
before you answer that, I
okay.
just want to piggyback off of that question too, because I think that that's important, because there's been a lot of information coming out about naturopath stuff and all the different vitamins and immune boosting things that you can take. Again, share your thoughts around, is it really going to help in terms of preventing contracting COVID-19? And if so, then what should we maybe be taking, or what should we be doing to make sure that we're keeping ourselves as healthy as possible?
So that is a very good question. And I'm going to give like a short version of a story that just happened to a relative. So I have a cousin that has COVID-19 right now, lives in a household with people that also have COVID-19, okay, or potentially have COVID-19. She, long story short, reached out to them. She got it from work. So calls into the hotline, tells them that she has it, or she thinks she has it. This is after a week of her being dizzy, almost getting ready to pass out, telling them that something's not right, them telling her not to come into the facility. She was adamant when she felt like she was getting ready to die and called and said no. She called the ambulance. She got in the ambulance, and her EMS driver still told her that she was misusing services and probably should have just drove herself there. So in the ambulance, they actually find, now mind you, I tell you that she's waited until it's a little bit too late. Her temperature is 99.4 while she's in the ambulance, and when she makes it there, it's 102.8. While she's there, she spends 3 weeks there. They say, we're going to send you back home how you came. She went home on oxygen a week and a half ago. Went home on oxygen, was never on oxygen prior to this happening. Job says that she can't come back unless she's on oxygen. Not only was she transferred off of her albuterol and was something called ipratropium, so we actually give both of them as a cocktail for a breathing treatment. They send her home on albuterol only. She starts vomiting. So now she's sick just from the albuterol. Calls her primary. Cannot get an appointment until, like a virtual appointment. Let's say this happens Thursday. She doesn't get the appointment until Saturday. Talks to them Saturday. Primary says, stay on the medication. I'm going to call you back on Monday. She calls me on Monday. She's crying. She's frantic. I don't want to take this, but I feel like I should, or otherwise I'm going to die. She feels like she's in a tough spot. And I told her to stop taking the medication because it wasn't making her feel well. But I also asked her about her diet. I get it. There's mixed controversy when it comes to dairy products. But I said, are you still having dairy products in your diet? She said, yeah. I said, you need to take those out of your diet. What are you drinking in order to be able to stay hydrated? She's telling me Gatorade. Do you realize that there's food coloring in Gatorade and what that does to the lining of your body? I said, so that too is a problem. I said, okay, so let's talk a little bit more about the foods that you're eating. So we're talking about the foods that she's eating, and long story short, they were foods that would definitely weaken the immune system. If anyone knows, like my previous work just in regards to food and its impact on our communities, that is a big staple of mine, and it does play a big part. I'm not saying that I treated her or I fixed her, but long story short, I juiced some lemon and ginger with some agave and gave it to her. Gave her 4 bottles, told her to take a half a bottle for a couple of days, and she's feeling better. She's not all the way 100%, but she's better. And so you are absolutely right that diet does play a big part. I'm actually working on information pertaining to that right now to figure out how can we get that out to our community. But I will tell you that behavior, even in the midst of it, is challenging for us because it's almost like we have to see our symptoms or we have to see our illness before we start working on stuff. And so this has been an uphill battle. But thank you. That's an awesome question.
The other thing I wanted to mention, I just recently traveled. The things that I did in regards to, try to be safe as possible and not bring things to, my daughter's house or bring things home, is that once I got to her house, I left my luggage outside. She Lysoled everything on the outside. And then when I brought my clothes out, I put them directly in the washing machine to be washed. And I did that same thing when I came here home. Soon as I came in, I just dropped out of everything and then put everything in the washing machine. And then I, sprayed everything down. I don't know how well I can, I mean, to me, I think I've been doing everything I need to. I don't, I'm not doing the mask because of what you said. It makes no sense. Everybody's touching everything and they think they're being safe all day long wearing the glove and the mask, and then they take it off and then they put it in their car, or they're laying it down somewhere. And to me, I feel like I'm just gonna sanitize my hands while I'm out and then wash my hands while I'm in the house, because it makes no sense.
So to your point, when restaurants open back up, she
Mm-hmm.
brought up a very good point that that's something to pay attention to. If a restaurant allows somebody to sit their mask on a table that you have to then walk up to and eat after they didn't took it off their face in order for them to eat, because they did not put it in a brown paper bag or put it in something safely, that is something to be concerned about. And so there are things that you will have to look out for your own self in terms of these establishments, without understanding that these establishments may not keep you safe. The other piece of it is the items or whatever you wear out shopping should not be worn in your home.
So, Shanina, thank you very much for all the question and answer. There are a few other questions, and I want to know how you want to pivot. Do you want to email, or if people have time, we can stay on? I just want to be sure we get through kind of our final wrap up. Would it work for you to stay on, or do you prefer to?
Yeah, we can stay on just to make sure that they're addressed, because I will tell you that I am busy and there's no guarantee that I'll get people timely information.
Okay.
And that's just being honest, and it's not on purpose. So.
Okay. Well, with that being said, I'll take the remaining questions. One is from Sora Kelly. She asked, has anyone read any studies regarding if any of those who survived COVID-19 had the pneumonia vaccine?
So you bring up a very interesting point. I can tell you that there are various studies. So some of the studies that are out there among these older adults, especially the ones that are in long-term care, they are required to get the pneumonia vaccine. They are also required to get the flu vaccine. Studies are out there still trying to determine, and I'm saying that carefully because we have to still look in the literature. So it may not make it to the media, but looking to see if there is some sort of correlation between the COVID-19 deaths as well as pneumonia and flu vaccines. However, there are other factors that complicate that. Older adults, 9 times out of 10, will have more than one multiple chronic condition. They may have some sort of gastrointestinal condition, they may have some sort of lung condition, they may have some sort of heart condition. So it's very hard to kind of tease out if the vaccines helped or hurt someone in that situation. But they are showing that with kids, and this is something that's being studied now, if the reason that children are not getting COVID-19 so easy is because they do have the vaccines. And so that is something right now that is being studied, or something that's being considered. Are they less likely to be carriers because they've already been vaccinated with their childhood vaccines?
Excellent. The next is from Sora Monique Winston.
I'm sorry, so sorry, Kalia. Really quick, I'm trying to think. National Institutes of Health, if they go to National Institutes of Health and even type in COVID, they can do searches there just with general terms about topics that you may be interested in. And that's it. Sorry.
Okay. Ohio is now doing elective procedures. Would you recommend it? For example, hip replacement, knee replacement?
The issue that we're having right now is, and this is just in full transparency, of course, the measures. So the safety measures, the quality and safety measures that ensures that hospitals are accredited, that hospitals are safe, that they receive maximum reimbursement. Those surveys, as well as Center for Medicare and Medicaid Services, quality improvement metrics have been suspended for the next 6 months. I am not telling you that that means that just because you go inside of a healthcare facility for an elective procedure, that you are more prone to getting an infection or getting a hospital-acquired condition. But I am just letting you know that with the strained system, with them also having personnel that may have exited school early to get a temporary license during this time, I do believe that things are more prone to error. So in my opinion, if someone had to go for a knee or a hip, if it is urgently killing you to the point where it's messing up quality of life, I would say go for it, but I would absolutely say to make sure that it's done with caution. I would not go over any holiday weekends. I wouldn't go if I could help it. But if I had to go, then I wouldn't go anytime near a holiday or a weekend.
And I'm just going to add to that. I believe the way the order is written is that it is still, there's procedures that can be done that are not overnight procedures. So depending on your comorbidities, depending on the facility that you're at, some people can do total hip and total knee replacement, maybe total knee in one day, but not everybody can do that. So it just depends. You consult with your healthcare provider and see how to go from there, but not all procedures are on. I just want to make sure that that's clear. If it needs to be overnight, it's not something that's approved at this moment.
Yeah, thank you.
The other, trying to think, there's another question. Based on the facts that you presented, this is from Sora Lori Washington, based on the facts that you presented relative to COVID not necessarily being dormant, would I necessarily be risking exposure to my parents if I moved them in with me from Detroit before next fall, if and only if none of us has symptoms by then?
I would suggest taking a look at what your day-to-day operations are. For example, if you are a healthcare worker, if you're an essential worker that you are around a lot of people all the time, I would not advise for you to do so, because that is potentially putting them at risk, not necessarily because they may be traveling out, but because you are traveling out and could potentially carry it back home to them. So that would be a concern. I will tell you, though, that we cannot live in a box forever. So we have to take as many preventative measures as we can. And if next fall is the time, or this fall is the time of which you are saying, I need to move them with me, because honestly, life still has to go on. I would spend this time between now and fall becoming the best infection preventionist that I can. I encourage people to do their homework. What is it that I need to do before I leave the house to make sure that I'm safe? One of the things that I will post, and give me a second, I'm going to stop the screen share, but one of the things that I'm going to put in the box is going to be a PDF link, and it's just going to be the shopping or being able to manage appointments. And so my purpose in sharing this information is not necessarily it is the end all be all. So I'll be pulling it up shortly. It's not because it's the end all be all, but what it does do is it provides you some sort of guide to say these are things that I should be thinking about. So there's one for shopping safety, meaning what should my trunk be packed with? There's one for what if I do need to go to a healthcare visit or someone needs things from the pharmacy. So I can imagine if your parents being here, they may need wellness visits. So understanding how to even navigate that in the current climate. Let me see. Oh, in-home visit. So that's another one. Someone may need to come in and do services. What does that look like? So I've posted 3 PDFs there. And so hopefully you all can download them, share with any family that you potentially may have for now. There is more information that will be to come on the other capacities, but I would say figure out what this checklist needs to be for your household. For example, for my own house, my husband is considered an essential business. So there's a procedure where when he comes in, he automatically goes to the bathroom, he washes his face, washes his hands, he has to remove his clothing. He does not put those items inside of our closet with the rest of our clothing. Shoes come off. So you have to establish your own rhythm to make sure that you're not putting yourself at risk. And so hopefully that helps. But I would just say get a routine down pat of how you can keep them safe before getting them.
Kelly, are there any additional questions? I actually have a question if there are no more additional questions.
I think there's one more hand raised, and that's Fabian Catrice will unmute her, and then Pam will turn it back over to you to ask your question and close us out.
Sounds good.
I've already asked my question. I do apologize. Go ahead.
No, it's okay. So Shanina, my question is, I read today on an article in CNN, they were saying, I don't know if you saw it, but they're talking about now recommending bubbles and saying for groups of 10 or fewer people who socialize exclusively with each other, that could be another recommendation for managing this COVID, but also still being able to socialize and be engaged. What are your thoughts around if this is still a safe tactic with everything going on?
Okay, my apologies. It stopped.
Did you hear the question?
I did not. It actually went
Okay.
out and yeah, like.
All right, you're okay. No, so my question is, there was an article on CNN today, talked about this new proposal around having bubbles for people. So if you socialize in a group of 10 or fewer and you exclusively socialize with each other, that is a safe recommendation in terms of, again, being able to socially engage, but also kind of managing, I guess, this quote unquote social distancing. What are your thoughts around that? And again, the best precautions to manage contracting
So I
the
can
virus.
tell you that we have a bubble. So I have been functioning in a bubble. And so it has not been, all of my family members. It's actually been my research assistant, who is working outside of a office in my home. It's been my brother and sister-in-law who also has their children at home. And we have certain procedures. So everyone sanitizes, everyone knows where everyone has been. We ask about cold symptoms. And that is the only social life that I've had since we've kind of been going through this, because some people still need to work. I've chosen to limit my circle, not just because I don't love people or I don't miss people, but understanding that my husband still works outside of the home. And so I have to realize that anyone that I bring into my circle, I am potentially putting them at risk. And so these social bubbles honestly do work. Like, I think that they work, and I do think that it is something to consider. Some people, it may be the neighbor, it could be anyone, but it's just, okay, what are they doing outside of their day to day that you can say, hey, where was you at today? Or who was that visiting? Or, I mean, these are real conversations that would actually have to be had just to make sure that everyone within that particular circle is keeping safe. And I hate to use this analogy, but it's true, and we are all adults. It is just like sex and getting HIV or getting pregnant. It only takes one time.
That is so true. That is so true. Kali, do we have any more questions before we conclude? Okay. Well, we would like to, again, thoroughly thank everyone for attending. We really hope that this has been informative for you. We hope that if you did have questions, that they were answered as we continue to kind of move through this COVID-19 epidemic together. I'm sure that we will, as things continue to unfold, we will continue to figure out ways to share information with you, keep our community informed so that you can make the best choices for you and your family. Again, we invite you out tomorrow for our medical supply donation drive. Please, if you have any donations that you can send our way, again, we'll be at the Delta Center for a drive-through anytime between 3 to 7. And before we close out, Shanina, if you have any other recommendations or closeout thoughts for us on this conference, please do share.
So one of the things that I know is important is educating the community. And I know I mentioned it in terms of an ounce of prevention is worth a pound of cure. Whether it's information that I'm sharing tonight, information that potentially you downloaded, sharing information with the neighbor. If you are, let's say, a organization, a single entity, figuring out how is it that we can get information to lower income communities. There's been a lot of emphasis in saying, oh, go to CDC website, go to WHO's website. Some people don't have access to that information. If they go to it on their cell phones, it's too small for them to be able to read. And honestly, you saw how we just went to the CDC's website and all of that, it's a wall of words. And so who has time in the midst of doing everything in life to read all of those words there to be able to sift through what's important and what's not? So one of the things that I am doing right now, and I'm actually going to pull it up and I'm going to hold the phone up to the screen because I think it's important, is figuring out ways that we can be creative and find digestible information. So give me 1 second. Hold on. Do you see that? It's just like a little screen. There it is right there. So it's a black hand and it's emphasizing hand washing, right? It's talking about the toothbrush for the woman that has the plastic nails or has long fingernails. It's talking about 3 to 6 seconds. It's very simple, but it's digestible information. The reason why I am focused on getting information out in smaller chunks to people, whether it is on, let's say, an index card ring binder, or it's some sort of sign, you know, a door tag that goes on their door that says, hey, prevention is the key, or we want to see you 5 to 10 years from now with no long-term effects from COVID because you didn't get it. That is the ultimate goal. And so the conversation has to stop being a victim and start being a victor. So you want to make sure that when people are saying, oh, it's killing people in the Black community, or, oh, my COVID symptoms were not so bad, saying yes, but 5 to 10 years from now, will we be able to say that? And unfortunately, we did not see that with conditions such as HPV. HPV was not a sexually transmitted disease. HPV, human papillomavirus. So it is a virus similar to coronavirus. And so people said, oh, well, this isn't a sexually transmitted disease that has symptoms, I'm okay. And years later, people showed up with cervical cancer for women. Men showed up with brain cancer. The point I'm trying to make is we don't know enough about this, and we've not transcended into the future to understand what the long-term effects are going to be. So make sure that you're doing what you have to do, but practicing to people that when they say it's a mild symptom or it's nothing, it is something, because you don't know what it's going to look like in the long run.
Shanina, what I did was I pushed on my Instagram, you know, the other things that people are not talking about is the people that are getting depressed and they feel lonely and they forget that they have people. So I did something like this where I pushed out, you know, for them to be able to communicate with each other. Remember to reach out to people, you know, to make sure that they're okay. You know, we have people that's in like the School of Nursing. So I've been reaching out to a number of people that I normally would talk to if I was at the building, because some of those people are by themselves and alone and they don't have anyone to actually, you know, communicate with. So we do Zoom, we do telephone calls, you know, so I think that's one of the things, just because they feel like they're safe at home, now they're isolating themselves to the point that now they feel in depression.
And that's what Dr. Jones was alluding to earlier. So thank you so much for reinforcing that.
Right. It's important to do those mental health checks and to make sure that, again, you're finding creative ways to engage with each other. The Zoom conference calls. I mean, I've seen things on social media like, driving by somebody's house and standing outside with a poster or, talking through through the front door, but things to still stay engaged and connected to one another, especially for some of our more senior population. They may not be as savvy with some of the electronic stuff. So finding, again, creative ways to engage everyone so that they're not alone.
Or your single friends. And so I want to emphasize that too, because these typically sometimes are the ones that have supported baby showers. They support everything about us, and so it's important to make sure that we don't forget about them too. So
Absolutely. Well, thank you all again. We pray that everybody stays safe and that you are doing the best you can to, again, continue to manage everything that's going on and keeping yourselves and your family safe. And thank you again for joining in on our conference.